transmitted diseases. Now it is called a sexually transmitted infection. Okay. So it is also called as sexually transmitted diseases. Most common infection. It is the most common infectious disease in the infectious disease in the United States. So it is also common in developing countries nowadays. It is transmitted through sexually contact from the infected partner, sexual contact from the infected partner predominantly. That is why it is called as sexually transmitted infection. So it may also transmit by placental transmission, like HIV, syphilis. They are also transmitted by the placental transmission. And they are also transmitted through the blood transfusion or infected needles like HIV, hepatitis, syphilis, and may be also transmitted by the inoculation on the infant's mucosa when it passes through the birth canal, like gonorrhea, chlamydia, herpes. So, sexually infected infection not only by the sexual contact, but they are also by the placental transmission, and by blood transfusion, by inoculation of the infant's mucosa through the birth canal. So, what are the reasons of increasing incidence of STI? Nowadays, incidence of STI is increasing. So, what are the causes? The most common cause is rising prevalence of viral infection like HIV, HPV. Okay, because of viral infection, the incidence is increasing, because in the bacterial infection we can give antibiotics and others, and fungal also. There are all the medicine for the bacterial and fungal infections, but viral newer type is increasing, so like viral HIV. So because of these causes, it is increasing, incidence is increasing. And most of the bacteria are resistant to the antibiotics. So newer generation of antibiotics is formed, even though it is resistance. So increased use of pills and IUCD. Instead of using condom, if we use more IUCD or pills, because it is very easy and compliance is more on IUCD and pills. So people are using mostly these methods of contraceptive. Because of this also, there is a chance of increasing incidence of the STIs. Condom is better in this case. Lack of sex education, because most of the people are from developing countries, they have lack of sex education, and if the sex education is not given in the country, then the chance of this infection is increased. Overseas travel. Previously, the overseas travel was very less, but nowadays, due to all the development, overseas travel is very high. Because of that, the people may bring diseases from the different countries. So because of this, also STI is increasing, and increasing awareness, and mostly viral origin. And most of the infection is mostly viral infection. Increasing STI is mostly due to the viral infections. Causes of STIs are gonorrhea. As you know, I think you have gone through in this from the school time. Okay, so school time, then college, and now. So non-gonorrheal gonococcal urethritis, syphilis, you know very much. Lymphgranuloma venereum is not very common in our country. Sancroid, granuloma inguinale, non-specific vaginitis, mycoplasma infections, viral HIV/AIDS, which you have a separate class for this. So we are not going through this HIV/AIDS, and then genital herpes that we will talk about, and condyloma acuminata, molluscum contagious, and viral hepatitis and CIN. For the CIN, you have the class for carcinoma of cervix and pre-invasive carcinoma of cervix. So CIN will be taught in that topic. and you have separate topic. So others which are common, we are going to talk about this today. And then protozoal infection is bacterial vaginosis, Trichomonas vaginitis. We have two classes for the STI. So next time we will talk about the bacterial vaginosis and trichomonal vaginitis. And fungal, that is monilial vaginitis. And ectoparasites is not very important, but that is also one of the STI. But I don't think I need to talk about the ectoparasites. I think in the infectious disease, you will go through the scabies. Okay. So now I'm going to talk about the chlamydia. And this chlamydia is very important. And this is the most common cause of the STI. And it brings lots of complications. So this is very, very important. Though you have studied this from the school time, I think you know not less about the chlamydia, but it is very important. So the causative organism you all know is Chlamydia trachomatis. That is an obligatory intracellular gram-negative bacteria. So it is the most common cause of STI. And it is transmitted by vaginal or oral or anal route, less often by the oral genital contact. And incubation period is 6 to 14 days. And it affects mostly in the columnar or transitional epithelium of the genitourinary tract, superficially. Okay, so it doesn't cause infection in the squamous, that is vagina. So it is mostly, it causes only at the columnar transitional epithelium, where you can find the columnar transitional epithelium in the genital tract. You should know. So you should know the what are the cells of the epithelium in genital tract. So it occurs only in the columnar and transitional epithelium of the genitourinary tract, superficially. So localized where you can find columnar transitional epithelium is mostly in the urethra, Bartholin glands, and cervix. So it infects the urethra, Bartholin gland, and cervix. And it ascends of stress and cause acute PID. It ascends and it infects the fallopian tube and around the fallopian tube, and then it causes the pelvic inflammatory disease. And it associated with there is a most chance of association of this disease, chlamydial infection, with a gonococcal infection in 20 to 40%. So what are the prevalence of symptoms? Prevalence of symptom is 15 to 30% of men who are asymptomatic. 15 to 30% of men who doesn't have symptoms is having chlamydial infection. And 50% of women who are asymptomatic have the chlamydial infection. So most of the female are asymptomatic. So what are the symptoms in the females? I'm not going to talk about the symptoms in the males, but I'm talking only in the females. So the main symptoms that occurs in urethra is chlamydial urethritis. About 1/3 of the women develop dysuria, pain, and burning micturition or frequent urination. And chlamydial cervicitis. If the infection in the cervix, then there will be cloudy mucous discharge from the cervix, and there may be itchiness or mild discomfort in the genitalis. And cervical edema, ectopy, friability. And if the infection rises up to the upper part of the genital tract, there will be pelvic inflammatory disease. With the symptom of this pelvic inflammatory disease is sudden onset of low abdominal pain, vaginal bleeding, fever, dyspareunia, and if you do the pelvic examination, it is very, very painful. And pain at the right hypochondrium may occur sometimes when even it rises upwards, and there may be perihepatitis, that is physitis, and by vascular dissemination of the transperitoneal involvement, that is caused by the vascular dissemination of transperitoneal involvement of the liver. So complication, what are the complications of chlamydial infection in the neonatal tract? Number one, as you know, it is a pelvic inflammatory disease, which may lead to infertility. And because of the tubal infection, more chance of infertility, and there will be ectopic pregnancy due to asymptomatic salpingitis by the tubal scarring. So by the infection of the fallopian tube, there will be more chance of having ectopic pregnancy due to asymptomatic salpingitis by tubal scarring, and this may lead to infertility also. And the infection can be passed to the fetus during vaginal delivery, causing trachoma, a chronic contagious form of conjunctivitis. This can be produce blindness in the new.